Recognising an urgent or emergency asthma attack is important. That's the first step. And then knowing the correct first aid manoeuvres to safely manage that while getting emergency help is the second step. So firstly, how we might recognise a life-threatening attack of asthma. Typically the patient's going to have more severe symptoms than they might have previously had. So they might have more severe shortness of breath. This could get to the stage where they're actually having difficulty speaking. In terms of recognising that as severe, another thing that helps with that is that it won't respond as readily to the inhaler treatments, reliever treatments that they usually use. So having recognised there may be a potentially serious or life-threatening attack of asthma, the second step is how are we going to respond to that with effective first aid. There's a recommended method, we call it, if you like, the rule of fours. A typical reliever that most people have available is Ventolin or salbutamol, and we can use that just on its own into our mouth. But ideally in an emergency we could use it in a small chamber which we call a spacer. So we would have the puffer connected to the spacer and we would be able to literally shake the puffer, basically have our lips on the spacer, puff it in once and then take 4 breaths. Each time we do it, it's 4 puffs with 4 breaths, then we wait 4 minutes and we repeat it. If at that time we've repeated it a second time, we're still having significant distressing dyspnea, it would be appropriate to call an ambulance and to clearly state that you're having a severe asthma attack. And at that point you would not stop using the Ventolin with the puffer and the spacer while you're all waiting for the ambulance to come. So you would in fact continue to use 4 puffs. Again, with each puff you would take 4 breaths. With each puff you would shake the puffer and then you would wait 4 minutes before repeating that whole process. It's just important to be really aware that even if a patient is able to function and do most normal things and work, if they're needing to use Ventolin on a regular basis to achieve that, they really don't have good asthma control. Generally, they should be making sure they have an accurate diagnosis. As long as they have asthma, they would nearly always require regular low-dose inhaled steroids. So the benefits of inhaled steroids are dramatic, the side effects really relatively small. It's definitely for most patients who are needing to use reliever treatment on any sort of a basis, the best thing to do is to start those inhaled steroids as soon as possible and to have an ongoing relationship with the GP.
Care to Share, brought to you by the Wesley Hospital, because your health matters.